All right.
Hey everyone, long time no see. Hope you're doing well. I just got a few updates. The first is I bonked my head with a hammer, and that's why I have that little spot there. Watch out when you use a hammer. Word to the wise. We have 1,759 cases and 72 fatalities. Yesterday we had 73. The health department periodically goes into the data and makes sure that it's all accurate, and occasionally we'll have a case that's reported that actually is from outside of New Haven. And so that's the reason that that number actually went down. We had, as you know, several mass giveaways today that were a huge success. And I just wanted to take an opportunity to thank the many different groups that made both of those mass giveaways possible, in particular CBIA, our New Haven Police and Fire departments for helping distribute masks and also keeping the streets safe. There was a lot of logistics and traffic involved in that, in both giveaways, and appreciate their support. Also, the Jewish Federation of New Haven had a significant role, along with CONCAT, in supporting the distribution of the masks in the New Hallville neighborhood. So thank you all for making that very, very successful. Testing sites are still up and running. As you recall, we have 5 testing sites in the city. We're exploring the potential of adding additional testing sites around the city, because it's clear that the different neighborhood sites are being used because of convenience and their locations, and so we're exploring those options. I can hand it over to Director Bond for some more updates on nursing homes.
Good afternoon, everyone. So for nursing home data, we are continuously monitoring and doing surveillance and working collaborative with our nursing homes. Today at the Grimes Center, we have a total of 75 COVID positive cases. And so just to clarify, with the Grimes Center, it's a local rehab center. So people in recovery of COVID-19 are in that facility. Does not mean that they have another outbreak. Their positive cases have been actually holding steady. And so I just want to make sure that I make that disclaimer. We have a staff total of 21 that tested positive. And so really what I wanted to share is there are also 7 more that were able to be recovered as of April 23rd. Mary Wade is another nursing facility that we're working closely in collaboration. And we, for Boardman, the resident total is 18 positive cases. Hospitalized are 4. And we had 2 untimely deaths within the Boardman resident side. From their skilled nursing facility side, called Kimberly, they had a total of 32 COVID positive cases, of which, and they also had 33 COVID positive, 8 of which were non-clinical. So we had 2 additional staff members since my last report. And the Department of Public Health recently visited this facility and provided additional recommendations. And they have also partnered with the local community health center to do ongoing testing of their staff and residents. And so they are working really hard to provide protection for their residents. Regal Care also is another nursing facility which we are working hand in hand and ensuring that they're cohorting and providing support. So they have about 32 positive residents at this juncture. They have a total of 15 COVID positive staff that have tested positive of COVID-19. Advanced Nursing, we have a total of 23 residents and a total of 10 staff total. That is a difference of 3 additional staff members that I reported last, and 10 more residents from my last report of our press conference. And so that concludes my nursing home data for today.
If I could add to that, just to clarify on Grimes. So initially there was an increase in the cases in Grimes And my understanding is the hospital has changed their approach and is actually transporting COVID positive individuals to Grimes as a site where they could be cared for.
Correct.
So it's not that there are additional patients that previously were negative at Grimes that are now becoming COVID positive, and that's why there's an increase in cases, but it's rather that the hospital is transporting people and basically designating Grimes as a COVID positive site so that they can care for COVID positive people in a way that is more cautious and won't expose other people that may be negative
Exactly.
to COVID positive. Another issue, because obviously nursing homes is a major challenge, and the number of cases is increasing over time, is we've been in conversations, and I know Fairhaven Health has also been very proactive about trying to test everyone in the nursing homes, both all the staff and all the residents periodically, so that we can much more quickly identify who are the individuals that are positive, who are the individuals that are negative, and then, as Director Bond said, support the nursing homes in cohorting those groups so that there's all the COVID positive people are in one place, all the COVID positive staff that may be asymptomatic or not sick to stay home can help care for those individuals, and then likewise with the COVID negative individuals. So that's something that we're exploring doing and supporting our nursing homes in doing.
Absolutely.
I know that New Haven Public Schools had some things to add about opening or closing of the schools for the rest of the year, the physical closing of the schools for the rest of the year. I know that education will still be ongoing.
Yes, Mayor. Good afternoon, everyone. I'm Keisha Red-Hannons, Assistant Superintendent. I'm standing in place of Dr. Tracy. Dr. Tracy is currently attending a virtual meeting with one of our schools at this time. So Governor Lamont announced that schools are closed for the remainder of the year, and we received this announcement with mixed emotions. We would have liked to end the school year with our students, celebrate their successes over the year, and provide closure with our staff. So this is disappointing. However, the safety and well-being of our students and staff remain top priority, so we agree with the governor's decision. We recognize that the decision to close schools for the remainder of the year impacts our entire school community, in particular, our seniors. Please know that we remain committed to celebrate their success, and we will hold a graduation ceremony for all of you when it is deemed safe to do so. Finally, Dr. Tracy convened a reopening schools task force to focus on operations, social emotional well-being, instruction, and governance. This team consists of administrators, teachers, staff, parents, and community members. The team will continue to strategize and plan for the reopening of school.
Thank you.
Mm-hmm.
Just one more note, and then I'll open up to questions. So typically on Monday, I share the overall numbers and the demographic breakdown. I just haven't had a time to do that today, so I'll do that quickly after this meeting, and then Gage can share that with the press. Are there any questions? Go ahead, Mary.
Just to go through those numbers.
Oh, I can email those to you, Mary. So I'll email them and have Gage send them to you.
Okay, and just, I mean, maybe just the explanation, because I think Grimes for the longest time was 58 people that were positive. Now it's up to 70. So you subtract one from the other, and the others are additional COVID positive patients being brought to the facility. Is that how the explanation goes?
Correct. So the Grimes Center is a COVID-19 recovery site, and so they have inpatients coming into the Grimes Centers that are positive and are being cared for.
Do you know how long ago they did that? They decided to make it a site.
I want to say it's been like a week to 2 weeks. I can verify the date. We can contact Grimes Center and confirm the date that they transitioned.
Or you could call the hospital directly. It's hard for us to say if the 58 or 72 minus 58, all of those additional people are new people. It's not our facility, so
right.
It might make sense for you to directly
All right,
contact
I can call
hospital,
it,
give
but
them
for the
clarity
longest
around that.
time, it was 58. It seemed, it was 58, 59. That was the longest. And so there was another mention of staff that might be positive, but they're asymptomatic, so they would continue to work. Maybe that was at the Mary Wade home.
No, so this is a philosophy on how to approach the
Yeah.
nursing home challenge. So there's a number of issues with nursing homes. Some nursing homes have several people living in the same room. A lot of nursing homes have a lot of the staff that are also COVID positive, and clearly it poses a lot of additional challenges if there's a COVID positive staff member that is well enough to work, because there's limited staff in nursing homes that are able to care for people.
Mhm.
And so if all of a sudden the nursing homes had half their staff that couldn't show up to work, they would have another very serious problem with just caring for people that need care. And it's difficult for nursing homes to always just find additional staff that maybe have not worked in their facility before and hire them to work. And so one of the potential solutions is to have COVID positive staff caring for COVID positive residents, and to kind of segment off a part of the building where all the COVID positive individuals, staff and residents, may go, so that staff can care for residents without exposing people to COVID because they already have COVID. I'm not saying that currently any of the nursing homes are doing that, but that's in our thinking through these problems. That's one of the ways that we're thinking about how we can approach this challenge.
Okay, so this is something that internally the city's department is talking about, or is the state talking about this too?
So this is something that the local health department is speaking with the nursing homes as well as community health centers in the region. So in the city. So it's just a proactive approach to just really be able to assess and distinguish who's positive, who's not positive, so that as they're developing interventions and ensuring that they are cohorting, meaning separating those positive, as the mayor indicated, those positive versus negative, they can be able to then create a more tangible plan to be able to address the pandemic within their facilities.
Okay, so if you know the state, beyond going to the Mary Wade home, the state health department coming in and doing what they promised they were going to do, have they done the other homes in New Haven too?
Absolutely, they have conducted site visits. We support at the local level just to kind of ensure that we're monitoring the positive cases closely, both from residents and the staff, and then just kind of following if they need support for PPE, making sure their protocols are in place. So we serve as a local support mechanism. The Department of Public Health has conducted site visits across the entire state of nursing homes facilities.
All right, do you know if we can get those reports?
You would have to inquire with the Department of Public Health.
Okay. And maybe one more question. There was testing, or the Fairhaven Health Clinic is going in and testing all the patients and staff. Is it just the Mary Wade, or is it other facilities?
Just Mary Wade at this point.
And they just started doing that as a
They have not started doing that yet.
Okay. Okay, thank you.
Yeah, and one other thing about nursing homes, I think there's been a lot of frustration and in some cases blame. While I'm sure there's many things that all of us could have been doing better to prepare for this crisis, I do think that many of the staff and management in nursing homes are struggling with a very, very challenging situation that they never imagined they would be facing. And the fact that it's so difficult for everyone to access PPE, but in particular there's been a lot of focus on hospitals and first responders, but for nursing homes, it's been much more of a struggle to access PPE. The environments that nursing homes typically are in, where people may be in shared rooms, there may be an HVAC system that doesn't separate air from different rooms. The healthcare workers, there's all kinds of challenges that they're facing. I do think it's important. Well, I'm sure there's things that we all could be doing better, to acknowledge the very challenging situation that they are in, and the hard work that so many people in the nursing homes are putting in to try to keep their residents safe while exposing themselves to significant risk.
Thank you.
I saw that Michael has his hand up, and then I'll go to Tom.
The reopening starting May 20th. I know that restaurants are one of the industries that are going to be allowed to reopen after May 20th with outdoor seating only. And I should know the answer to this question, but I don't. Do restaurants in the city of New Haven require a special permit for outdoor dining? And does that depend on whether the actual seating is on like a public sidewalk versus in a private yard on the side of a building?
So you should know the answer to that, but I really should know the answer to that. And I'm not sure as I fully do know the answer to that. I know that restaurants can't just put tables and chairs out on the sidewalk, right? Just the response to the larger question about reopening and outdoor dining, we are anxious to know if there are more details to what the governor's reopening proposal is. And also, my understanding is that May 20th is not a decided upon date and is dependent on a number of health indicators before moving forward with any incremental reopening. In particular, the number of hospitalizations going down for a period of 14 days, our ability to test and conduct many more tests than we currently have capacity for, et cetera. The governor has a list of different health criteria that will presumably be checked off before we reopen. I think we're all anxious to reopen, but we need to do so very safely and thoughtfully. And I know that our team is thinking through what exactly this looks like, and it's all the details from how we might facilitate more restaurants being able to have outdoor seating with tables that are spaced apart, and also ensuring that there's not a block party because of it. If we do say, work with the alders and other community members to shut down the street to open up more seating. Those sorts of details we're really working through because we want to make sure people are safe.
So on a theoretical level, would the city be, if there is a permitting process for seating on public property, would the city be open to the idea of trying to streamline that process so restaurants can take advantage of that?
Yes, the short answer is yes, we need to do it safely.
Thank you.
If I may, Mayor,
Go ahead,
there is a permitting process for the if the request is to be in the public right of way, like
Okay.
the sidewalk seating. Obviously, if you have a patio or other space on which is in the private space, then it's regulated by the site plan review when it's proposed.
Thank you for the clarification.
Thanks, Mike. I'm going to go with Tom and then Shana.
Thank you very much, Mayor. I'm sorry to hear that you hit your head with a hammer. Sounds painful.
I was more sorry than you are at the moment. Now I feel better.
I have a question for Assistant Superintendent Red Hannons. Thanks for the update about the task force that the superintendent has put together. Do you have a sense of when this task force will be meeting, kind of how regularly will this be open to the public, and how many people are on this task force?
So we held an additional meeting last week. The task force will continue to expand with more members. We have not set a regular meeting schedule at this point. And I will get back to you on the meeting calendar and it being open to the public. We will definitely get back to you on that. But we know it's expanding.
And you said it was an initial meeting, but what generally did you all talk about at this first?
Just the four, we just discussed the 4 key areas: operations, social emotional well-being, instruction, and governance, and started to brainstorm around what we will need to do in those domains to reopen schools. And a lot of what we're just looking at now is gathering research, seeing what other districts are doing. It's hard because this is a new phenomena for everyone. So you're not going to get best practices, but we can definitely seek the guidance from our health officials. Our state is working with the federal government. Our State Department of Ed is working with the federal government as well on how we should launch and reopen schools and what we need to think about to open our schools as well. So we're just scratching the surface on this, and it's very much in its infancy stages.
Thank you for that. Mayor, I'd love to hear your take on how the city's 5 testing sites are are going so far, especially now that the Day Street operation is running. And I also want to point out a Connecticut Mirror article from earlier today that reported that the State Department of Public Health has shown that the state's averaged about 2,800 test results a day for the past 2 weeks. Despite a lot of talk about a surge in testing statewide, the numbers actually reported by the Department of Health don't seem to have shown that. Now, obviously, we've seen actual testing sites open in New Haven, but one, could you speak to how the sites are doing, including the new ones? And two, have we actually seen a significant increase in the number of tests being conducted and results returned in New Haven?
So this is actually a really good question. After I give a response, I wonder if Director Bond could also weigh in. I don't have the daily numbers of how many tests have been conducted in New Haven, so but I'm happy to get that information from you. We've noticed an interesting phenomenon in a couple of cases where our capacity for providing tests isn't reached. So for example, the CVS site last week had a much lower number of people come to get tested. So they had a lot more capacity. The Chapel and Day Street site also has much more capacity than the number of people that are getting tested there. The Fairhaven Health site has been very, very busy every day. And I think Cornell Scott on Dixwell Avenue has generally been busy, but has a little bit more capacity. Director Bond, you can correct me if I'm wrong there. Mm-hmm. And I think that's an indication. There's potentially a number of reasons for that. And I would speculate that some of it is marketing. Some of it is convenience of making sure that because the neighborhood sites have been generally more popular, making sure that we have more locations around the city so that people are more able to access it. And some of it is about starting to lower our threshold about what's an appropriate reason to get tested. Because for a long time, for months now, we've been saying that only if you're symptomatic should you get tested. Now, in the long run, the right approach is for many, many more people to get tested because, as has been clear from a lot of the media recently, many people that are asymptomatic still have COVID-19 and are spreading it. And so our goal in the long run is to make sure that many more people get tested. Director Bond, do you have anything to add?
Yeah, so absolutely, I agree in totality with what the mayor is indicating. And so what we are looking at right now is, as we scale up testing, is to ensure that we are also screening those that are asymptomatic so that they have that option. And of course, just working with community leaders to ensure that messaging is getting out regarding the availability of testing. For us in New Haven, we've been tracking the number of people that have been tested in total since March. So we have about 5,282 of total testing in New Haven specifically. And what we've been doing, of course, this is just a static view because laboratory testing results done in other areas outside of Connecticut takes a minute to get into our surveillance system. But overall, our positive rate from the number that I just shared, it's at 47% from that. So of course, it's reported from the lab confirmed. And so what we're hoping to do is to expand testing availability for anyone that wants to be tested if we can scale up to that level and make it available to the community.
Thank you very much. That was a very helpful response. Just so I understand, you said that 5,282 tests have been done in New Haven City in total since mid-March. But the mayor reported earlier today that 1,759 confirmed positive cases, but then
Correct.
You just said 40. You said
that's
47%.
Yeah, that's 47%? About percent positive tests are overall 47%, 53% are negative.
Mm-hmm.
Tom's trying to do the math here.
Yeah, I know. Is that?
I'm just going based on my power. I don't have my calculator out, so it better be right.
Well, while I also scramble for a calculator, I do have another question. Mayor, I wanted to ask the New York Times reported recently that the Trump administration has, they're now projecting secretly or something like that, that there might be up to I think 3,000 people a day dying from COVID-19 potentially by June 1st, which is kind of a staggering number to see. I know I asked weeks ago if you all have a projection for what infections and hospitalizations and deaths in New Haven might look like a month out. I'm going to ask again, do you have that kind of projection? And even if you don't, what are you thinking about now as you follow kind of local and regional and national news about where New Haven might be a month out from now with the coronavirus outbreak?
Yeah, we don't neither secretly nor publicly have any projections of the number of potential fatalities. Frankly, I would expect the trend to the number of fatalities typically trails the number of positive cases that we're seeing and hospitalizations we're seeing for obvious reasons. I would expect that number to continue to slowly and gradually climb, even as we are starting to see and hopefully continue to see a reduction in the number of hospitalizations and the number of positive cases that we're seeing. That's, of course, with the big caveat that people practice social distancing, wear masks, and we don't open up too quickly. And frankly, while there's many people in the community that are practicing social distancing and wearing masks, we're seeing more examples as the weather gets nicer of people not following these rules. And it's very important that people continue to follow these guidelines, or else we're going to have many more problems. There was a second part to your question, Tom, as I recall. Was that,
that was just generally kind of your response and thoughts to what a month might look like. I mean, obviously the governor still has his May 20th opening up deadline.
Yeah,
so.
I think, I mean, our daily increase of cases is slowing. And I'm very hopeful that that will continue to happen. But I'm also very cautious about making any sort of indication that we're out of the woods, because I think we have a very long way to go. And my concern, particularly for urban centers like New Haven, is that it's more challenging for us to do the kind of opening up because of that might be easier for suburban communities. Just because of some inherent challenges of us living in a closer environment together, and I think this is a real health equity issue as well, where there's many more people that are highly at risk in urban centers, and I think that we just need to be very cautious about how quickly and how we open up. I saw Shayna.
Awesome. Can you hear me well?
Yeah.
Okay, cool. So this is more geared toward the school system. Obviously, Governor Lamont making the decision to shut down schools. I know that we have had several discussions with both the superintendent and with you, Mayor, about distance learning being a struggle for a certain percentage of the population. I believe last time we spoke, it was 10% that was not engaging in that distance learning. And I'm wondering where that struggle stands, and what you guys are doing to address the kids that are still not at distance learning, whether that's because they don't have a laptop or whether that's because of another extenuating circumstance. I'm wondering, and then this follow-up to that is, how are you going to promote them?
So we're continuing to move forward with distance learning. The schools are physically closed, but learning will still continue. We are repurposing funds to purchase more Chromebooks. We're also seeking philanthropists to help us to purchase devices for our students as well. Our youth family community engagement team, they're making contacts, whether through phone or email, with our students that are disengaged to get the root cause of why they are disengaged. And we are in the process of continuing to re-engage them. So to date, they've been able to reach over 1,500 students and speak with them. And then we are providing devices where we can to those particular students. But it remains a huge challenge for us. And that is the reason why the schools reopening task force is very important, because we know it is very likely that we may end up in this situation at some point during next school year. And so we want to be ready.
And I guess my follow-up to that is, how is grading going to go if you still have a population that's part of your student population is essentially MIA? I mean, are you passing kids that aren't doing the work, or is it like what's going to happen with that? And how do you compare it to kids that have the resources to do the work? It kind of feels like, you know, I just want to know where those kids stand and how are you grading them?
So we conducted a survey of our staff as well as our students and parents. We had over 980 responses from our staff members and over 3,800 responses from our parents and students. And the survey looked at how do we grade the fourth quarter? Because essentially we're only talking about 1/4 of the school year. Students were in school for the most part for 3 quarters. And so from the survey responses, our staff clearly indicated they were uncomfortable failing students. Parents said they leaned more, 54% of them leaned toward an A to F system for fourth quarter, but that's almost split 50-50 when you really look at it, when you say 54%. So we decided to put together a policy. We brought it before the governance committee last night of the Board of Education. And the policy simply states in K-4, we'll just look at engagement. Were you moderately engaged, did you have limited engagement, or were you highly engaged in the educational process? For grades 5 to 12, we're looking at pass or not graded, depending on their level of participation. So students will pass, or they will pass with distinction if they had 80% or more engagement during this fourth quarter. What is key and what can't be understated is the fact that transcripts only report the final grade. So the grades over the 4 quarters are not reported on the transcripts, and overwhelmingly the staff voted to only factor in the first 3 marking periods and the midterm into the final grade. And that was the policy we put forth before the governance committee. The Board of Education will discuss this policy next Monday and vote on it.
So essentially you're either passing or passing with distinction, but there is no fail.
Pass with distinction or not graded.
And what does not graded mean? Is that like almost like incomplete?
For the students that had limited participation. So we're not going to fail them. We're just not going to provide a grade for that particular quarter. As I stated, we had 3 quarters of school, so they still will receive a final grade. It will just be over those 3 quarters in the midterm.
Oh, so you're taking the average of the 3 quarters to grade them.
In the midterm for the final grade.
Okay.
That is the proposal we put before the governance committee, and they're moving it on to the Board of Education. So that policy will be voted on next Monday.
Gotcha. I think your assistant superintendent or someone from the school department, I think Mr. White, I believe his name was.
White.
Dr. White, excuse me. Sorry about that. So Dr. White had mentioned something, and I kind of want to reiterate that. He had said that he didn't want to, or the policies that you guys were discussing weren't to be punitive. Correct. That a lot of these students aren't participating not because they don't want to participate, but rather they don't have the means or the resources to do so. Would you agree with that, and can you expand on that idea?
Yeah, so there's a myriad of reasons why our students are not engaged right now. It is not simply because they don't want to participate. We just received a story of a 18-year-old senior who father was laid off. So he took a job working full-time. He can work full-time because he is 18 years old. So now he's working a 40-hour day. And so for him to come home and do his schoolwork and do it at a high level is really challenging for him to do. And he's questioning whether I work or do I do my schoolwork. And at this time, he has to make the economic decision for his family. we have other families where we have older siblings taking care of younger siblings throughout the day. So they have added responsibilities upon them as to why they're not engaged in the work at the level we may like them to be. And then we have other families who have decided they don't want their children engaged in distance learning, and they're homeschooling their kids during this time. So there are a variety of reasons as to why our students will not participate, and the staff did not feel comfortable failing any students, knowing that it wasn't equitable for all students at this time.
Mayor Elicker, you had kind of touched on the equitable idea as well. Can you kind of speak to that as well, and kind of what you've seen as a city leader and how you're working with the schools as well?
I think this just exposes, I think this crisis in general has exposed inequalities that have existed for a very long time. And that's around food insecurity, that's around housing, that's around education. And we've been having a lot of conversations internally, particularly in the last several weeks, about how ideally we would take this as an opportunity to redefine some of the ways we think about some of these problems and potentially come out of this crisis much better as a society. And there's all kinds of areas where there's opportunities there. You think about how this crisis has exposed that we don't work well regionally as a state. We don't have a county system. We don't have the infrastructure in place to be able to collaborate with our regional partners. And it's so important when you're in a pandemic to do that. So there's opportunities for us to collaborate more regionally, and that impacts our education system, that impacts our ability to support individuals experiencing homelessness, food insecurity, all these issues. So my hope is that something good will come out of this crisis. And it's certainly on the education side, really pushed us, and I think not just City Hall and New Haven Public Schools, but our community as a whole, to talk about access to Wi-Fi, access to technology, the challenges that individual families face at home with being able to support their children and provide a good learning environment. So it's making us think a lot about these issues, and I'm hopeful that we'll be able to come out of this much stronger and start to think the ways we face these challenges.
If I can just follow up with one more question. I know you mentioned in the beginning of the call, you guys would talk about statistics and numbers. Were those just about nursing homes? Because I think I connected with Gage and asking about hotspots and where the numbers are as far as neighborhoods and race and cases and how that is.
So I said that I was going to share the race ethnicity data after the call. I just didn't have time to put together the document today yet. So I'll have Gage send that out shortly.
Gotcha. Okay. I wasn't sure if that was related to the nursing homes or something separate. So I just wanted to confirm that.
Just the total cases?
I'm sorry?
It was the total cases?
No, I was asking about the hotspots in New Haven, in particular, if it was a race breakdown.
Yeah, for the total cases of the city. Yes, the total cases of the city, correct.
We'll put that out. And I'm not sure if folks saw the Director Bond's note about the dashboard percentage. So the positive rate is 33% for total tests in the system. So good catch, Tom Breen, on that.
Yeah.
Any other questions before we go? I'll go Mary and then Tom. Oh, I'm sorry, Mary, I just muted you accidentally.
Okay. I also would like the information that breaks down the number of tests by site. I tried to get that before, and I don't know, I wasn't able to get it.
Are we able to get? Do we have that information? You're talking about the number of daily tests that are conducted by site, Mary?
Yeah.
Yeah, we don't have that data.
I don't know if we have it broken down that way.
You don't. Okay, so you just have a total. Okay, but
Sorry.
you know the numbers are low, or you have a lot of capacity at these sites.
I wouldn't know.
What do you mean by sites? The testing sites?
I'm talking about the testing sites.
Got it. Yeah, they're being reported to this the Department of Public Health and inputted into the surveillance system. And so they're not broken down by testing site. That's not how they're using their baseline metrics. They're just reporting positive cases in general into the surveillance system, and then we get them divided by city.
But just to clarify, Mary, some of the sites are underutilized. That doesn't mean that they are not utilized well. They are just not utilized to their capacity.
Correct.
Other sites are very, very popular and being used to their full capacity.
Right, okay. And so you're talking about expanding the whole testing. We know it was really limited the way they let people do it in the beginning, and now it's better, it's easier. What would stop the city from doing that? I mean, is it the supplies? Is it the swabs? Is it, so you'd have to wait for.
Yeah. It's
You'd have to wait for,
PPE, it's PPE, it's the swabs, it's the site, it's the supplies, it's the staffing.
Correct. So there's a lot of logistics that goes into this, Mary, and so we have a logistics team, and we know where the hotspots are in our city, and we're looking to, you know, scale up our testing. We just want to make sure that it's done right. And so we want to make sure that we have the capacity and that we have all the logistics resolved to scale up. But that is certainly a conversation the city's having on a daily basis.
Okay, so you have to wait for other people, everything, all this to come together to actually, I mean, personally, I'd love to be tested, you know, it's.
You can. We have 5 testing sites right now.
But don't you have to really have to some kind of, you have to have, I suppose, right? I mean, you could still have it be asymptomatic. Are you basically just opening it up to people that are asymptomatic and just want to get a test?
Yeah.
Well, so
it would be great to have you come to one of our testing sites. You can come to Day in Chapel tomorrow morning. We'll make sure we get you tested.
But to be clear on that, I'm not sure as we have a good answer for you yet, Mary. So we don't have control over the Yale New Haven Hospital site, nor do we have control over the CVS site, or for that matter, the Fairhaven Health or the Cornell Scott one. My understanding is that the Yale New Haven Hospital site and the CVS site still are only accepting people that are symptomatic. Because we have some additional capacity at the Chapel and Day site. Is it correct, Director Bond, that we would accept some people that are asymptomatic? I'm reluctant to say that we should yet, without having a conversation with our community health partners, direct people to those other 2 sites if they are not symptomatic. But this is something we're thinking about as because we want to make testing more available to more people.
Yeah, absolutely. So that's why I invited you to come to our Day Chapel Street site, because that's a public-private partnership with the health department. And so you can certainly are welcome to come to that site tomorrow and get tested.
I just don't want you putting in the press, you can go to any site if you're asymptomatic, because it's not fair for us to say that.
No. Then I mean, specifically, I would say if you're asymptomatic and want to get a test, go to the Chapel and Day site. I mean, that's right? You should.
That's okay.
Right. Okay.
Make an appointment before you come.
Yes, ma'am.
Tom, go ahead.
Thank you. Did the Blakefield Triage Center open today, and will there be testing there?
I don't have confirmation on whether or not there will be testing there. We've talked about that. I don't know if Director Bond, you know the answer to that. We can confirm that. Cornell Scott is one of the providers there of services, and they have the ability to test. I'm not sure if they're doing testing on site. Again, we've sort of gone back and forth on whether or not that's going to be an option. We can confirm that. It did open today, and it opened at 12:30. As of around 1, they had already had a couple people come through. I haven't gotten an update in the last 3 or 4 hours. I'd encourage you to go by, but it's closed for today. It closes, I think, at 4 or 4:30.
And Director Bond, did you have confirmation on whether or not there's testing taking place at Blakefield, or?
I do not have confirmation, but I can follow up with the team that's working on that particular initiative and see if that's something they're considering.
Great. And that's it for me. Thank you so much.
Thank you. All right, everyone. Thanks so much for joining. As always, we'll see you all soon. Take care.